Hello, this is Dr. Lowell Chambers. I'm a surgeon with Central Ohio Surgical Associates who practices primarily out of Mount Carmel West. I'm also the surgery department chair there, and I'm the program director of the surgery residency. But it's in my capacity as the co-chair, along with Dr. Martha Regal, of the Clinical Advisory Committee for the Zero Harm Quality Initiative that I'm speaking to you in today. Our Zero Harm Starts With You program is similar in nature to one successfully used recently at Nationwide Children's Hospital. In 2007, the quality team at Children's recognized that their serious safety event was not where they thought or wanted it to be. Specifically, they were experiencing a serious safety event every 11 days. Concerned about this, they employed a quality consulting firm, Healthcare Performance Improvement LLC, and embarked on a quality and safety initiative that they dubbed Zero Hero in 2008, with the goal to eliminate preventable harm within 5 years. What they were able to achieve was remarkable. After an initial anticipated increase in serious safety events at the onset of the initiative, a phenomenon which is expected due to improved reporting and recognition of events, the Zero Harm program produced a marked decrease, as you can see here, in serious safety events and mortality. And although they didn't quite make zero by 2013, between 2015 and 2016, Children's went with an entire year without a serious safety event, greater than 365 days between serious safety events as compared to a baseline of 11. This gained an interest of our leaders here at Mount Carmel, and the decision was made to employ the same consulting firm used by Children's to see if we could provide our patients with a similar benefit. Recognizing that although many of the issues, perhaps even most of the issues between different centers are the same, each facility also has unique characteristics and as such require a tailored initiative. Mount Carmel therefore has its own initiative, which we're calling Zero Harm Starts With You. This builds off our established Because of You brand and seeks to employ validated patient safety and provider leadership techniques to decrease and ultimately eliminate preventable harm to our patients and employees. A summation of these techniques can be expressed by the acronym START, which I would like to briefly go over with you in the remaining minutes of this podcast. Before we get to that, though, I'd like to clarify why I, someone who, quite frankly, is somewhat busy with numerous professional as well as family commitments, and someone who is typically somewhat cynical about administrative-led initiatives, why I am very passionate about this initiative. In part is because I can't help but be impressed by what they were able to accomplish at Children's Hospital with a similar process, but as I became more familiar with the techniques and approaches that the initiative is to entail, I recognized that the majority of them were very similar to steps that we took to improve outcomes when I was serving in the Navy and Marine Corps Forward Resuscitative Surgical System on several combat surgical deployments. There, confronted with high volumes of injuries of a magnitude seldom seen at most civilian centers, we found ourselves with some initial bad outcomes, some of which still haunt me to this day. In response, we adjusted many of our processes and kind of made some others up as we went along, but the essence and spirit of teamwork, cross-checking, repeat backs, attention to detail, and speaking up were all very similar to those being recommended by the Zero Harm approach. With the employment of these principles, our unit was able to go on to achieve historically good outcomes and were credited with setting a new standard of forward surgical care by Colonel John Holcomb, the senior trauma consultant to the Surgeon General, when our data and outcomes were formally presented and published. So by my experience, this stuff works. I believe in it. I think it is a great opportunity for us in the Mount Carmel system. Now, the Zero Harm process has actually been underway for some time, with the initial steps being a thorough evaluation of the Mount Carmel system by the HPI consulting firm with the assistance of our quality and safety teams. Past safety and serious safety events have been tabulated and evaluated to provide a profile of where we are at now. And where we're at now is not where we would like to be. As you can see, not a month has gone by over the last 2 years that we haven't experienced a serious safety event leading to preventable harm in our system, with most months, unfortunately, having multiple events. Now, numbers are one thing, but I like this graph because its emphasis that each of these events represents not just numbers, but people. People with families and friends who love and depend on them, people who have entrusted their care to us, but people who we have, at least in part, let down by allowing preventable harm to come to them. People like Josh, who came to us with some atypical symptoms and was found to have evidence of a myocardial infarction, but this was not recognized and acted upon appropriately, ultimately contributing to his death. People like Anthony, who was actually a patient of mine, recovering from a major abdominal surgery. His infusion rates were mixed up on a potassium rider and insulin, leading to severe hypoglycemia. Now, fortunately, this was recognized and he ultimately did well, but it was a significant setback nonetheless. When the analysis was completed, 80 serious safety events resulting in 11 deaths were found. This equates to one patient every 9 days on average that's being harmed in the myocardial system. In other words, almost every week a patient somewhere in our acute care facilities is currently experiencing a preventable event that results in significant harm or death. This clearly is not acceptable. Now, is it any worse than Ohio State or Ohio Health? I don't know, probably not. But that doesn't change the fact that we can and must do better for our patients. So how do we go about doing better? Well, that's what we're going to learn together in training sessions that we're asking each of you to participate in. But some of the things which we will go over in these sessions are a recognition that most serious safety events are not isolated events. They're the results of multiple errors, a perfect storm, if you will, or a Swiss cheese model, if you will, of Swiss cheese holes lining up in ways that we can hopefully put barriers against and put protections in place to make such series of events much less likely by correcting latent errors and other system weaknesses. We're going to learn about how our mind works in 3 basic modes, each of which has different mechanisms for error and how we can protect against each. These tools are summarized by the 5 behavior expectations of speaking up, teamwork, attention to detail, reliable communications, and thinking it through, and the associated error prevention tools. What do these entail? Well, again, that's what the courses are for, but briefly, under Speak Up, we're talking about clarifying questions. These clarifying questions, when done appropriately in high-risk situations and in situations when information is incomplete or not clear, can lead to a decrease in error risk of up to 2.5 times. Arcing it up, asking, requesting, expressing concern, chain of command, principles which encourage all team members in the healthcare team to be part of the process and speak up when you see a potentially dangerous situation. Under teamwork, cross-check, and 5-to-1 feedback to help foster a collegial work atmosphere where we're all able to put individual issues aside and focus on something bigger than ourselves, delivering world-class service to our patients and working together toward this goal. None of us alone is as good as all of us together. Attention to detail, recognizing that even under optimal circumstances, we are all fallible humans with an error rate ranging at best between 1 out of 100 to 1 out of 1,000 actions. Now, for most aspects of life, this is acceptable, but in a complex endeavor such as medicine, even one of these errors can lead to death or serious harm. Zero harm draws from tools such as STAR, Stop, Think, Act, and Review, drawn from high reliability professions such as aviation and nuclear power to help block or minimize such errors. Reliable communications. Despite being the so-called communication age, it seems that there's never been a time when our healthcare teams have communicated more poorly, at times with devastating consequences to our patients. With the Zero Harm Initiative, we will be incorporating validated communication tools such as SBAR and 3-way readback to facilitate communication. Thinking it through. The final group of tools of validate and verify and stopping the line will be employed to assist with engagement of each team member in the process. I feel privileged to work at Mount Carmel, and I believe that we deliver excellent care. But, like the majority of medical centers, we are not at this point a high reliability organization. Through the Zero Harm Initiative, we will change that, and in so doing, propel Mount Carmel to new heights of performance. Sign up today for the training and join us on this journey toward excellence, a journey toward zero harm.